my name's Lena, and my presentation is on speech therapy. Speech therapy is the therapeutic and treatment region of field, and it studies like language disorders and specific problems with swallowing. So like when people get really nervous and they feel like their throat is closing up and they can't swallow, people help with that as well. And then also just regular problems with speech production. So there's two types. There's two types of them. There's expressive language disorder, and these are people who, although they may be like a specific age, they can't produce vocabulary that's like appropriate for that age, or they have difficulty expressing their feelings in writing, or they have trouble forming simple sentences for their age group. The next group is receptive language disorder, and these are people who have a problem with language processing. Even if it's like their core language, they still can't really understand what people are saying, or they can't put it into words how they feel. They have difficulty in following directions, and they have trouble with reading in their language. So this is just a slide that I put in later on because I thought it was kind of interesting. These are some of the techniques that speech therapists use. The first one is they use mirrors to help patients who have issues with facial movement. The next one is toys to help children with articulation and speech patterns. And then the next one is exercises to strengthen facial muscles for diseases and problem swallowing. So for people who have like cerebral palsy. And then teaching alternative speaking devices for sign language, or with people like cerebral palsy or those who are deaf. There's multiple levels of occupation, so it kind of goes from speech pathology aid on. The speech pathology aid is the one that needs like the less schooling, and then all the way down at the end, which is research in language and hearing, are people who need a doctoral or licensure in that one. So the first one is speech pathology aid, and these people need a certificate in that field, and all they do is help the speech and language pathologist assistant. So they don't really have like a big part, but whatever the speech pathologist aid or assistant needs, the aid will help them with that. And then the next one is speech and language pathologist assistant. These people need an associate or bachelor's degree, and they work side by side with the speech language pathologist, which is SLP for short. The next one is speech and language pathologist. These people need to have a master's degree, and they need to be licensed in their state of work. Most states require a license. There was only like 2 of them that didn't. And they can work alone, or they can work with other speech and language pathologists. It just depends on what setting you work in, if you work in like a large hospital, or if you have a private practice. An audiologist is someone who works specifically just with people who are deaf, and they need a doctoral or license. And then if you want to go beyond that, you have to do a doctoral in research in language and hearing disorders. And those people need licenses as well. And they just kind of try and find new ways to incorporate speech and language into what an SPL or an SLP would do. All of these ones require continuing education. It's required to keep your license, and it's required in all the states, all the 48 states that have the license. To get the continuing education, the easiest way would be to go through American Speech and Language Hearing Association, which is the ASAH. They have workshops every year, and they have continuing membership education, or continuing education for members. You do have to pay to get in it though. Some natural abilities for this occupation would be, you have to work with all ages, because it can range from children who can't speak very well to adults who are becoming deaf, or people who have cerebral palsy in their like mid-30s. You need to be detail-orientated, because you're working with a whole bunch of different patients, and not everything is going to work for every patient. So you have to be really careful of what type of technology or what type of techniques you're going to use with one patient, what type of techniques you're going to use with the other one. You have to have a lot of patience, because these people are frustrated that they can't speak like everybody else, and they can't perform all the duties that everybody else can do. You have to be communicative and compassionate about what you do, and then you also have to be analytical. The same reason for being detail-orientated, because everyone's not the same. So in your workplace environment, it really, like I said earlier, it depends on where you work. If you work in a hospital setting, you'll probably be working with a lot of other people. If you're like a private practice, you'll be working by yourself most of the time, except for like the team that you have, like the aide and the assistant. It also depends on who you're working with, like who your patient is. So if you have a small child, it's usually with a group of people, that way they don't feel isolated and by themselves. And then with adults and people who have issues, speech issues because of the disease that they have, it's usually one-on-one for the same reasons, so they don't feel, so they don't feel isolated, but so they don't feel kind of vulnerable amongst a whole bunch of other people. And then that's it, and there are my citations.
Any questions? Would you see the speech language pathologist like in the grade schools for like the delayed children?
Yeah. Mm-hmm.
Okay, great. All right, so we'll go ahead and take a break, come back.